Welcome people. In this video, let us look at the contraindications of corticosteroids. You should have watched the adverse effects and then come to this video, okay? Then only you will understand. The following diseases are aggravated by corticosteroids. Since corticosteroids may have to be used as a life-saving measure, all of these are relative contraindications in the presence of which these drugs are to be employed only under compelling circumstances and with due precaution. Got it? All you have to write in the exam are these terms 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 and you will get your marks. Contraindications. Should you use in peptic ulcer? No, because it will increase gastric acid secretion. Diabetes mellitus, it's precipitating diabetes because it is going to inhibit glucose uptake by the peripheral system. Hypertension, it will increase BP because it will increase sodium and water retention. Viral and fungal infection, it is an immunosuppressant. Corticosteroids is an immunosuppressant. So obviously viral and fungal opportunistic infections will come. Tuberculosis and other infections, yes, of course, you should not use because latent tuberculosis can come to light. Other infections also, it's an immunosuppressant. Osteoporosis, if you use corticosteroids in long term, it will make sure that the bone is going to be demineralized and osteoporosis can happen. So if there's already osteoporosis, you're not going to give corticosteroids. Herpes simplex keratitis. There are a lot of skin fragility happening because of corticosteroids. I'm guessing that's the reason they are saying this. This can also be an infection, so immunosuppressant. Psychosis, psychiatric disorders can be caused. You saw that there can be euphoria. Hence, you should not give. Are you awake? So, we are covering psychosis. Psychosis, obviously, corticosteroids will cause mild euphoria and sleep can decrease. So, if there is psychosis, you cannot give corticosteroids. Epilepsy. Now, what happens in epilepsy? Glucocorticoids, they maintain the level of sensory perception and normal level of excitability of neurons. Higher dose lowers seizure threshold. So, use in epileptics requires caution. High dose lower seizure threshold. Okay. Is that clear? Moving on. Congestive heart failure. What is CHF? It is congestive heart failure. Obviously, you will have to protect the heart here. Now, if you give corticosteroids, the sodium level and the water retention will increase. Water level increases, blood volume increases, blood pressure increases. So, it is not a good thing. Renal failure. Now, you should understand that anywhere, wherever there is liver failure, renal failure, you cannot give any drug because, they'll be contraindicated because the liver cannot metabolize them. The renal system cannot remove the metabolites from the body. So, all of these will be standard contraindications for you, okay? You'll have to lower the dose or something. Fine, in any of these cases, you may have to lower the dose or use with caution. Or short time, short acting drug, something like that, okay? Did you understand the contraindications? We are done with the contraindications. Just a small revision we can try. Peptic ulcer, psychosis, diabetes mellitus, congestive heart failure, hypertension, renal failure, viral fungal infection, tuberculosis, herpes simplex keratitis, osteoporosis. Did we forget something? I covered this, psychosis, covered. Everything okay? Done? See you in the next video. Tata, bye-bye.